Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good morning, everyone. I am Dr. Varun Rehani. I'm a senior consultant neurologist. I am working at BLK Max Super Speciality Hospital at New Delhi, and I'm also available at Neurocare Solutions, Rajendra Nagar.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, seizure is a very common problem. The brain as an organ is a master organ, and in this organ, for every command and every output, everything we say or do, we have electrical signals. It's like a master computer. So, when there is some misfiring or there is an electrical overload, these can cause the patient to have seizure. And what is seizure? So, these are abnormal jerky movements of the body or some partial loss of consciousness which the patient may have.
What is epilepsy?
Epilepsy is the disease. So, not every patient who has had a seizure is an epileptic patient. It's a very common mistake that most people are failing to understand. So, epilepsy means a disease in which the patient has a risk of having repetitive seizures, that is at least twice in their lifetime. So sometimes patients may have seizure, which may be because of, say, high grade fever, because of some other illnesses like low sugar, because of low sodium. So these things are like symptomatic seizures. It is because of the situation that the body has had and it has caused the patient to have a seizure. So these patients may not be epileptic.
What are the different types of seizures and do they affect people differently?
Absolutely. So to classify, we usually simply classify epilepsy or seizures into two types, which is partial and generalized. It means it basically needs to tell about the origin of the seizures. In focal seizures of the brain, the electrical discharges are starting from one point or one focus, whereas in generalized, it is present throughout the brain. So the generalized seizures everybody understands. That is, the patient will suddenly have those jerky movements. If they're going to become stiff, they're going to have those tonic-clonic movements. They're going to have uprolling. They may have frothing from mouth. They may have tongue bites, and they may pass urine. And when they regain, they are confused. They are lethargic, and they take time. So this is the common phenomena that every patient or every person understands. The focal seizures, however, they're going to start from one part of the brain. So, say if they start from the frontal lobe, so these patients will typically have seizures at night. They will be hypermotor type of seizures, meaning that they'll be very loud. They'll be probably paddling, and the family member who's going to be sleeping beside that person is going to be unaware because they are all sleeping, and they will just find the patient having some tongue bite or pass. They must have passed off urine. The other epilepsies in focus, they may just have one-sided abnormal movements of the body. They may have just speech-related problems. They may be just transiently unaware. They may have transient global amnesia. They might be unaware of what they are doing for a longish period also. And one common generalized seizure which is seen in the children's is also very important to be identified. In this, what happens? These children, they are just daydreaming, and the teachers points out to the parents that your child is not doing well. In fact, it is not the
Yeah.
child who is daydreaming. The child is unaware. For 30 seconds, the child goes blank. So these are common types of seizures which everybody needs to know.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So, no matter how much science may advance, it may not be able to tell all the answers. So, yes, we do have lots of causes for epilepsy. So these can be trauma, these can be your tumors, the brain cancers, stroke. Sometimes stroke, in fact, may come present like seizures, and once the stroke heals and becomes a scar, these scar can also cause seizures. Then all types of infections, bacterial infections of the brain, the tubercular infections, these are also known to cause epilepsy. And then there's a major chunk of genetic causes. You may find the MRI to be normal or abnormal. In these cases, you have some developmental abnormalities. The child is born because of these perinatal, when when the baby is being coming out in the world. They may have hypoxic injuries. They may have hypoglycemic injuries to the brain, which may cause them to have epilepsy. But these still account for only 50%. In 50% of the cases, we may not find any cause, but we still have to treat our patients.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So I have probably just said it right now, but I'll still answer it. So common signs and symptoms, as I told you, those jerky movements, up rolling. The patient may just move his neck to one side, abnormal jerky on one side, facial twitchings. Then they can have passage of urine, stool. They can have tongue bites. They may be transiently confused. The speech may become transiently abnormal. They may have tongue tremors, tongue trembling thing phenomena. So these are common signs and symptoms which the patients will have. And sometimes the patients can have aura-like feeling. They may have understanding that they're having. The attendants who are very sharp, they must be able to tell that before having the seizure, the patient is making some hand movements. They are looking at one side. They are having some lip smacking. The one side of the eye is blinking. So the some attendants are able to identify these subtle signs also.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
So, epilepsy, when the event happens, it is such an event that it creates panic and fear in the surrounding. It is such a fearful event when anyone sees it. And when it happens, when that person processes it, it processes it in a negative fashion. And this has been happening now, and this has been happening for ages. So that is why these people have these population have been secluded. A community across all over the world do not like to speak to them because they feel that they are cursed. They feel they are mentally disabled. They are intellectually down. So not all of these patients may be like this. So this accounts for the negative attitude accounts for the comorbid anxiety and depression in these patients. And in fact, 1 in 3 of these epilepsy patients have anxiety or depression, which is the most common comorbidity of these patients. They face issues with their profession, they face issues with their marriages, and even their children face the issues. So the community as a whole needs to be educated that we need to be supportive of these population, and this is a non-communicable disease. It will not come to you even if you are close to them. So this is a very common thing that they need to understand.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So yes, the two most common questions that we face is, Doctor Saab, कब तक दवाई चलेगी? For how long are they going to take the medicines? Is it going to be lifelong? And secondly, I tell them that the question is the what are the precautions. So number one precaution is they need to be truly and thoroughly compliant with their medication, because this is the most common cause of recurrence of seizure. So if they miss their medicines, they're gonna have seizures. If the doctor has prescribed you your medicine, it means that he believes that you are at risk of seizure. That is why you have been given those medicines. Secondly, they need to create a sense of calmness around them. For that, they need to have regular sleep, 6 to 8 hours a day. They need to do some forms of meditations or deep breathing exercises. They have to avoid other triggers, that is like flashes of light. They cannot dehydrate themselves. They need to have adequate water. Need to have adequate salt, because dehydration and low salt are also common causes. If they have other comorbidities like diabetes, hypertension, they need to manage their other aspects also. If they develop fever, they need to tell to their general physician that they are having seizures, so that they do not give those common medications which are seizurogenic. And they need to avoid having those screen times, especially those in which there are bright flashes of lights or loud sounds, which may provoke their brain and sensitize or cause them to have seizures. So these are the common triggers that they need to avoid.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So in their lifestyle, as I told you, having a good diet, they need to have all sorts of colorful vegetables. Do not be choosy. If you have to be choosy, then avoid those especially processed junk foods. Avoid uncooked food, because those raw foods in forms of the vegetables or even meat can have organisms, can have parasites which can infect your brains. Try and keep a healthy environment so that your immunity is also better and you can fight infections. Do not delay your fever treatments. Do regular exercises. However, they need to avoid driving. They cannot drive, they cannot do swimming. They should avoid any sports which has a tendency to cause injury to the head. So they can play most of the indoor games, and in outdoor games they need to have those specific headgear so that the head doesn't get injured.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So if a person is having seizure in front of you, the first thing that is most important is for that caregiver who's going to help that patient is that he or her needs to be very calm. They cannot be like panicky, and they're not going to be able to take care of that person. So once that person is calm, they need to do is immediately turn the patient to one side, so that if the patient is seizing, the secretions that the patient is going to have, the frothing from mouth, they're not going to aspirate in and develop those pneumonia. So they turn the patient to one side. If the patient is having any tight objects, tight clothes, they need to untie them of those things. If they find any surrounding sharps, then those things need to be removed. If the patient is at home, and the at home they should cover all those edges, so that if the patient has epilepsy they do not injure themselves. They should probably have some carpets or soft mattresses over their floors as well, so that if they fall down they do not injure themselves. And the other thing that they need to do is that they can obviously create a small pillow sort of a thing from any nearby cloth they have to support the head. Most importantly, do not give anything by mouth until the patient is conscious. Do not put any spoon. Do not make that person smell the onions or the socks. It is of no use. And you need to be with that patient, with that person, till that patient is alert enough. And if that patient hasn't regained consciousness within 5 minutes, you need to rush to the emergency if the patient has not regained consciousness.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
So, my final advice to my patients would be that if you've had a seizure, do not neglect it. Show it to your nearest doctor. If you're not satisfied, show it to another doctor. But do get all the tests done. Do take your treatment. Do follow up regularly. Do your lifestyle measures so that you are free of this disease. It is a completely controllable disease. We may not be able to uproot it in all the cases. We may not be able to cure you in all the cases, but it is definitely very, very manageable.
Thank you, doctor. And thank you to our listeners. Until next time, Take care and stay informed.